Several states, including New York, California, and Texas, say they will not follow controversial new guidance on coronavirus testing. The CDC had recommended tests for anyone who came in close contact with an infected person. This week, though, the agency revised that, saying people exposed to the virus who don't show symptoms may not need to be tested. The exposure issue is getting new attention after the huge annual motorcycle rally in Sturgis, South Dakota this month that's been linked to dozens of new cases. Chief medical correspondent Dr. Jon LaPook shows us why the CDC's change is alarming many in the medical community.
If you've had a high-risk exposure, you should be tested.
Dr. Tom Inglesby is an internationally recognized authority on infectious diseases and the director of the Johns Hopkins Center for Health Security. He says he does not agree with the Centers for Disease Control's new guidance on testing.
We've been told that contact tracing is the meat and potatoes of trying to stop an epidemic or a pandemic. How does this interfere with that?
If we stop testing contacts, we lose information about what's going on in our own community. We know that something on the order of 40 to 50% of people with this disease in the United States don't have symptoms. There are a lot of people who are asymptomatic who are at risk of spreading this disease.
Let's say on day one, person A is in close contact with person B, and 9 days later finds out person B has just been diagnosed with COVID-19. As early as day 3, person A could have started asymptomatically infecting others. If person A goes into self-quarantine without being tested, those contacts may not be notified of their exposure to coronavirus and may go on to infect others.
I got an example of someone I know whose child was just exposed to a COVID case. That child is going to stay home for 2 weeks no matter what. But if that child also tests positive, then family members have clear risk and others in her life might have clear risk.
A federal health official tells CBS News the push for the change in guidance came from the Department of Health and Human Services and the White House Coronavirus Task Force.
When you do testing to that extent, you're going to find more people, you're going to find more cases.
Throughout the summer, President Trump repeatedly blamed widespread testing for generating alarming case numbers and headlines. On Thursday, the Vice President's Chief of Staff, Mark Short, said one reason for the change to the CDC's guidance was the long wait for test results.
The guidance that was updated is because there continue to be backlogs in the system with the testing, particularly for people who are getting tested or asymptomatic.
But Dr. Inglesby says the change does not solve that problem.
The solution to that is to fix the turnaround time. The solution is not to slow down testing or to start eliminating groups of people who need to be tested.
A few days after the guidance change, the Department of Health and Human Services said in a statement, the guidelines received appropriate attention, consultation, and input from fellow task force experts, including CDC Director Redfield, who advised coronavirus-related matters among departments and agencies. And CDC Director Dr. Robert Redfield released a nearly identical statement, but included a recommendation that people who have been exposed talk to their health care provider or to a public health official about whether or not to get tested.
John, what are other experts in the medical community saying about these changes?
Anthony, they're confused and they're upset. And my sources tell me that inside the CDC there was disagreement about that policy change, which is why you saw Dr. Redfield come out a few days ago and try to clarify things by saying, look, if you've been exposed to somebody, you're asymptomatic, you're exposed to somebody who is infected with COVID, you can consider getting tested. But the infectious diseases expert I spoke to, most of them, all of them actually, uniformly said they don't want to just consider being tested. They want the person to be tested because we've learned that asymptomatic spread of coronavirus is extremely important in this pandemic.
Yeah, and as you point out, making these changes does not solve the problem in delayed testing results. John, thank you very much.